The U.S. government is now recommending fewer vaccines for our children.
We first brought you this story as breaking news here yesterday at 4. The Department of Health and Human Services making that announcement. So here it is in case you haven't seen it. First of all, measles, mumps, and rubella, MMR, and vaccines against polio, chickenpox, HPV, and others will still be suggested, but they're no longer recommending meningococcal Hep B and Hep A unless you're at higher risk. If you're higher risk, then you should get it. Community Health Network's Dr. John Kunzer is here. He's a pediatrician and Community Physicians Network president. Thank you so much for being here, doctor.
Good to be here.
Okay, hearing all of this, it just puts an alarm bells off in my head. Having a toddler, hopefully having more children. I don't know what to do. What do we do as parents?
Yeah, I heard this news yesterday and I was confused. And I'm a parent of 3 children. As I read about it more, I actually have to say I am deeply, deeply concerned about the future of children's health from this recommendation. I don't know the people in Washington, D.C. and why they make the decisions they do, but I do know the people that wear the white coat. And as physicians, we take a pledge to do no harm, to not let politics into the exam room, our decision making, and to speak truth. And this is where the American Medical Association, the largest organization of physicians, American Academy of Pediatrics, largest organization of pediatricians, and Society of Infectious Disease Experts have all said that they do not agree with this recommendation from the U.S. government, and that they should stick with the traditional recommendations because vaccines are safe and vaccines save lives.
Have you been hearing from parents? Have your doctors been hearing from parents who are calling and asking, what do we do? We've heard about this, we're confused.
Yeah, and I don't blame them for being confused. And I think that they'll have questions. And I would really recommend to parents, go to the most trusted resource, and that's your pediatrician, your family medicine doctor.
What do you hope, I think, people walk away with, because it does seem like politics have creeped into the exam rooms and the doctor's offices?
Yeah, I guess I should look right at the camera when I say this, is vaccines are safe and vaccines save lives. In fact, the CDC, it's still on their website, they did a study from 1994 to 2023 that reviewed vaccines and found that those vaccines prevented over 500 million illnesses, saved over 1 million lives, and saved the economy $3 trillion. So vaccines are safe and vaccines save lives.
And what are you most concerned about at the end of the day?
The confusion that it's going to create to parents, and it's going to create some vaccine hesitancy. So some parents are going to say, I don't want to give those shots now. And we're going to see those diseases start to pop up and reoccur. We've seen this with measles. So we saw a measles outbreak. And these diseases are real. We're in the midst of an increasing flu outbreak, and there are kids. Last year we had 288 individuals in the country die from flu. Most of those were children that were unimmunized. So people can die from the flu, and people will die from meningitis if they don't get vaccinated.
Yeah, I have a 21-month-old at home, and I ask questions, as every parent should, and my pediatrician explained the fact that this is a schedule of when they should receive the vaccines, and that the testing, the research, decades of research has been done on this exact schedule. So it seems as though when you start manipulating that, my question, which you don't have to answer because you're not in Washington, but what science, where's the decades of science that says we should change the schedule and go this way? What is that based off of? And would that be safe? Because I thought, maybe I should wait on some vaccines and wait on others. My pediatrician recommended not to
stick with the schedule.
It's studied and presented as a schedule.
Absolutely. Yeah, we should get you a white coat, because that's what I think.
I know you're new here, just so you know, my white coat's in the back.
That is exactly what doctors are asking, is where is the evidence? Where is the science? So this came about, just so you know, 1 month. So the president issued a challenge to say, look at the schedule. And they did this in 1 month without the scientific review, without the normal committees that they use to review that. And they've come up and said, well, Denmark does this. Well, Denmark's a country of 6 million people. We're a country of 340 million people. So there's a lot more disease burden here.
Well, we could talk about this for hours. Unfortunately, we're out of time. Thank you so much for coming on and providing some insight. More online at WTHR.com.
The white coat looks better on you.
Oh, thank you.